Hello everybody, I'm NONYE'S. Thank you for joining me today. In this video series, I highlight various patient attributes and attitudes that can manifest due to underlying anxieties, and I also highlight how the healthcare practitioner can identify such attributes and then engage strategically to promote a more trusting environment in the healthcare setting. Today I'm going to discuss the dependent patient, and before I proceed, I must first mention at this point that in addition to being a healthcare practitioner for many years in the healthcare system, I'm also a patient in the healthcare system. I had a surgical procedure in 2013, and although I feel so much better today, and I thank God for that, I continue to maintain routine medical checkups at my doctor's, so I can definitely relate to the various levels of anxieties that patients could present with due to the feeling of unknown in the healthcare system. So someone asked me some time ago what type of patient I was following my surgery in 2013. And I remember I am a dependent patient now I think back on it. Because during my recovery period, I was overly dependent on my doctors. I completely relied on their judgment and suggestions, and I made little or no effort to contribute to the consultation process. And many times I gave simple yes or no answers. And also I shied away from engaging in more details with the clinical conversations with the healthcare practitioners. And this can be partly due to my culture, because being originally from Nigeria, I had a lot of reservations, and there was also a timidity about voicing my opinions as a patient, because I am a healthcare provider who is familiar with healthcare proceedings, and I still found myself that when I was in front of my doctors, I just felt very timid about voicing my opinions to them. And in this way, I just completely relied on their judgments and suggestions, and I made little or no efforts to contribute to consultation dialogues. I find that there are certain cultures where patients could present to the healthcare settings with the fear of questioning authorities, such as the nurses or the nurse practitioners or the doctors, and they will be reluctant to voice their opinions or to give suggestions about their treatment plans due to the fear of upsetting the doctor. And sometimes this could be due to innate personality types or even psychological factors or behaviors that could be from cultural practices. The point I'm trying to make here is that when a clinician identifies a patient with this type of attribute, the clinician should set a goal to assist the patient to disclose more information during the visit. This can be achieved through asking open-ended questions. And the clinician can pick a topic of interest, briefly discussing that topic at the beginning of a consultation process will help the patient open up and for a better dialogue to ensue as time progresses.